I'm Sophia
Perfect.
Aragon. Oh, okay. Thanks, Brenda. Because if we're running out of time, I'll just go ahead and fast forward on some stuff. I'm a registered nurse, and I'm also an attorney by background. And for those of you who might be here kind of surprised about that, is because in nursing, you help people every single day, every time you are providing patient care. One of the things that you need to do to be a really good nurse is to be a patient advocate. And so what that means is that we work really hard to make sure that the patient gets what they need. And so I'm going to start off telling a little bit of a story as of what a nurse did for me. Is that when I was, let's see, I think I was 21 years old, and all of a sudden, my joints started hurting and I couldn't move. And so I just had a lot, but it was really painful. So I started having arthritis all over my body. Okay. And so I called, well, this is what I always do, is called what they call the consulting nurse. Usually every hospital or major health system has one, and you can talk to this person on the phone, and what they could do is give you some advice about what might be happening. And if you need to come to the hospital right away, they will certainly do that. So when I explained what was happening to me, she goes, "Yeah, you need to come in right away." And so I went to see the doctor, and I said, I said again, I go, you know what, it hurts, and I said it hurts to sit down. So what that meant, it's hurt to go to the bathroom. It hurt to open the car door to get into my mom's car. She had to drive me to the hospital because it was too painful to move any of my joints. And when I was in the doctor's office, he gave me a physical examination, which included kind of looking at my joints, seeing how I was hearing my story, and also drawing medical labs. So what they do is they draw blood, as some of you know, and they wanted to see if there was anything that showed that I had arthritis. So when you look at someone who has arthritis, usually there's something called the rheumatoid factor that shows up in medical labs. Okay. And so the lab came back, he ordered it in emergency. So he got it about 5 minutes, and he's like, I don't want to call you crazy, but your labs don't show you have a rheumatoid factor. So he kind of sent me home, and here I was in like massive pain. And so I called the nurse again, and I said, and I just started to cry. And I said, look, I can't, like I said, I can't go to the bathroom. I can't open a door. I can't drive anything. My mother has to drive me everywhere. And here I was 21 years old. And then she said, and then I told her my symptoms again. And she goes, you know what? I'm going to send you right back to a specialist, someone who's a specialist in rheumatology. And I'm going to do that for you. And I said, and I was told her, I'm so grateful that you're doing that. She goes, you know what? Sometimes we have to advocate for ourselves to get what we need in healthcare. And so I went to the rheumatologist, who is a specialist in medicine. And then she did her examination, and she knew about my labs. And she goes, you know what, you have so obviously have what was called psoriatic arthritis, which is something that was genetic in nature, and that it basically hits all of your joints in certain ways. And in my type, it was hitting all of my joints except my spine. And then so she immediately got me into medication, and within about 6 months, it was controlled. But it was a pretty hard thing to do because they had to adjust my medications. But anyway, if it wasn't for that nurse, I would be sitting at home thinking that I thought something was wrong with me, but that first doctor didn't think anything was wrong with me. And without her, I would have not seen that specialist, because back in those days, it might be easier now, but only a doctor can send you to another doctor to make sure you have something going on. So that's an example of how nurses advocate for their patients. Okay. In terms, I'm going to just say a little bit about the Center for Nursing. Is the work that we do is to make sure that there are enough nurses out there to serve the public. And we're in constant need of nurses, like every single type of nurses. And many of you are asking me about different kinds. So I'm just going to go ahead and go through those so that you have a good sense, and that you all have an opportunity to ask questions. Okay, so in terms of nursing, so there are more registered nurses. I'm going to talk about 3 different types of nurses. I'm going to talk about the licensed practical nurse, which is about a year of training in community college. registered nurse, which some of you shared that you knew that you can get that at a community college. It does take more than 2 years, and I'll talk about that a little bit. And the advanced registered nurse practitioner, which gets an advanced degree after they've graduated from a 4-year college and university. And I'll talk a little bit about what they do. But overall, registered nurses are the largest healthcare workforce in the state as well as in the United States. And today there are about 4 million of us nationwide. And that's important because when nurses care about something, they can really change how healthcare is done. And I'll give a little bit of example of that when I'm finished. So registered nurses are the largest group. We have about 100,000 of them in the state of Washington. Licensed practical nurses are actually shrinking in number, and they're a little under 6,000. I have some numbers as I go through the presentation. And the advanced registered nurse practitioner is also a small group, about 8,000, but they have a lot of ability to take care of people and provide good care. Half of the jobs in registered nursing are in hospitals. And those of you mentioned, you're interested in being in the emergency room. So that's definitely hospital nursing. Let's see here, what else is there? Medical surgical, that's definitely hospital nursing. So a little over half of nurses work in those settings. But nurses also work in a lot of different settings like public health. And those are the nurses, for example, who are in charge of what happens in COVID-19. A lot of times we're in charge about where vaccines are going to be provided, who needs to get the vaccines, educating the public about what's happening with COVID-19. And some nurses work in nursing homes. We call that long-term care. Some nurses work in clinics. Some nurses travel from house to house providing care. And also some of them work in government, and I'll talk about that in a little bit. So a lot of you know what nursing is, and I was hoping to have a little discussion about what experience you've had with nurses, but many of you have had that. So I'm not going to spend a ton of time, but if we have a little time later, that would be something I would like to hear from you. So when you look at the licensed practical nurse, again, there's about 1 year of training and education there. Most of them do work in long-term care. A lot of them work in nursing homes. As I mentioned with registered nurses, we have about more of them in hospitals than anywhere else. And then for nurse practitioners, they usually actually work in clinics most of the time. And the thing about advanced registered nurse practitioners, this isn't the same in every state, but Washington has really been a leader in it. But in many roles of advanced registered nurse practitioners, they can do the same thing as physicians. And one key area of that is mental and behavioral health. So they can do the exact same things as psychiatrists. They can prescribe the medication. They can see you and diagnose you and tell you what kind of care you need or what disease or condition you have. And they can prescribe the same treatments as physicians. Now, overall, the limitation of advanced registered nurse practitioner is they don't do surgery, okay, in the state of Washington, but they can do everything else that a physician can do, okay. Major roles is that usually a ARNP chooses 4 different areas. One is the family nurse practitioner, and most of them choose this route, and they're basically like the family doctor of a family, okay, and they can do that. Psychiatric mental health practitioner, about 8% of them practice there. Nurse anesthetists work in dental offices or operating rooms in hospitals, anywhere where anyone needs anesthesia, okay? And we have one school that provides that degree, and that's out in Gonzaga in Spokane. And then the certified nurse midwife, which can deliver babies for women. Okay, so any questions about what nurses do before we talk about nursing school itself and how to get there? Anyone have questions? And actually, Brenda, if you could help me look at the chat, and if you guys just want to ask questions in the chat, I'm happy to answer those as well.
Thank you, Sophia. Yep, I'm watching the chat, so I'll let you know maybe
Okay.
when a question comes up. Thank you.
Okay. Okay. Thanks. So in terms of career earnings, registered nurses and advanced registered nurse practitioners earn a really good living. Again, nursing is different in many states, but in general, in the West Coast and in the Hawaii, nurses earn the most. So a full-time nurse in the Seattle area, I'll say could probably make 100,000 working full-time. Okay, and it's because of the high demand, and also depending on if you choose certain shifts. Like if you work night shift, you are generally paid more, and an evening shift paid a little bit less, and then day shift paid a little bit less, because they're paying you for working these really odd hours. Also, they need nurses so much that a lot of nurses work overtime. And so if you are customarily, for example, paid, say, $25 an hour, you get additional money per hour because you were there because it's a holiday, you had to work more hours, etc. On the West Coast, I mentioned too that we generally are paid more than other nurses from other states. So actually, a lot of nurses travel here, because, well, the West Coast is generally considered a really nice place to visit and to live. And also, though, because that the cost of living on the West Coast and Hawaii are one of the highest in the nation. So nursing here, at least in the state of Washington, there's really good advocacy to make sure registered nurses and ARNPs are paid in a way to make sure that they have really good living wages and can afford homes here in the state of Washington.
So there's a couple questions in the chat box.
Sure.
So can you become an RN in 2 years?
The registered nurse in 2 years, you're referring to community and technical colleges. That's the nursing program itself, but you still need to finish prerequisites to get into that nursing school. So for example, you'll need to finish some math, some general chemistry, biology is one of the typical prerequisites to get into a nursing school.
Okay.
So usually it takes more than two.
And I have an ADN instead of a BSN, or what's the difference?
So the associate degree in nursing are usually graduates from a community college. Bachelor of Science is from a four-year college and university, although I'll say the laws have changed so that community colleges can also award a Bachelor of Science. And the Bachelor of Science typically is 4 years, a four-year program to complete.
Okay, so we have a question that says, how long do you have to be in school to be a registered nurse practitioner? So I think they're an advanced registered nurse practitioner.
So, okay, in general, so you finish your Bachelor of Science in Nursing, become a registered nurse. Nurse practitioners afterwards generally take 3 years in addition to be an ARNP. There are some schools in other states that you can be an ARNP with 1 year less with a master's degree. But that's less and less becoming the case in the state of Washington. And I would recommend that you get the degree that nurse practitioners typically have here in the state, which is that 3-year Doctor of Nursing program. Okay.
Mm-hmm. There's just one more question, then
sure.
Sorry. So it's a good question. Are prerequisites high school classes, or what are prerequisites?
Oh, prerequisites just means these are college classes you need to take in order to be admitted to any college program. Okay, so for example, if you go to the University of Washington and you're looking at applying to their nursing school, they'll say you need to take Chemistry 101, which is general chemistry. You need to take Chemistry 102. You'll need to take a math class, and they may be specific, like Math 105. I'm throwing out these numbers because that's what they were when I went to school. They might be different numbers, but it might be a specialized class in statistics, for example. So one of the things I want to say in general for those of you in high school is that you might vary in terms of how advanced you are in math. So you could certainly, when you get to college, take math courses to strengthen your skills in that area. on the way to a prerequisite, okay? And also I would just really pay attention to these different prerequisites. Let me tell you why. Okay, so here's kind of a mistake I did when I was at the University of Washington. I had a lot of friends who wanted to get into many schools, all who were requiring chemistry, but I didn't really understand there were different levels of chemistry. So for example, I had friends who wanted to go to certain medical schools and they want to be engineers. For engineering, general chemistry is actually 3/4 or a year long in study. For nursing at the University of Washington, there was a 1/4 class in general chemistry, okay? And similarly, you have to take organic chemistry. And again, if you're studying engineering, organic chemistry is yet another whole year of chemistry, but for nursing, it's another 1/4, okay? Same thing with math. If you say general math to an engineer, that means calculus. And here's another mistake I made. I did a whole year of calculus. I didn't have to do a whole year of calculus. I just needed to do mathematics statistics, which was 1/4 at the University of Washington. It's really important to know specifically what your prerequisites are because nursing is very competitive. So if you don't need a year of chemistry, which you can imagine the high level of studying that needs, and you need to get that A because honestly, that's what you need to do to get into to be really competitive for nursing school, then you just need to take the chemistry that is required for nursing and don't overlook that you might be signing up for chemistry more appropriate for engineering, okay? Also, when you choose schools, and my stepdaughter is going through this right now, schools like the University of Washington, say you're admitted, you still have to apply to get into the School of Nursing after you finish your prerequisites your sophomore year. And that just shows how competitive that school is. There's other schools who are like Seattle U, where you can declare nursing as a major starting your freshman year. And so they already have you on the list. You're already on this road to become a nurse. Now, that doesn't guarantee you will finish as a nurse school because you still need to do well, right? But just know that some schools are able to enlist their students right away as freshmen. So that's just something to think about in terms of how much you want to be competing for that nursing slot once you're in college. Also, some schools do require that you have a CNA license first because that's just part of their regular admissions process. Not all schools require that, and it's usually the community colleges that require that. If you want to have the experience as a CNA when you're in college, I know one of you talked about being able to get that experience when you're in high school so that once you're in college, you have that under your belt. That's one way to do it. Just know that the first couple of quarters in nursing school is CNA training because we have to know that stuff anyway to do the work we do. So you can actually take the CNA test after you've spent some time in nursing school if you truly want to do that to work, okay? The other piece is that there is positions called nurse techs who are nursing students that are hired by hospitals in the summer to do work that they've already learned in school. I did this. So for example, after my first year at Seattle University College of Nursing, I applied for a nurse tech program. And so I got a job over the summer at a hospital just up the hill, which was Swedish Cherry Hill. And I was able to experience, night shift, day shift, evening shift. I was able to work in a number of different units, all the way from critical care to acute care, just to see what it was like. And because they knew me as a nurse tech, they actually hired me after I graduated from nursing school, and they gave me a job. Once I was finished with the summer job, I can sign up for however many hours I wanted to work until I was done with nursing school and worked to get my license that way. So just know that there are many opportunities available for you to work while you are in nursing school. Okay, but you also have to know how much work you can do at the
Sophia,
same
we
time
have
stay on
one
top of
more
studies.
minute. So I don't
Oh,
know. Your
okay.
great information. I don't know if you
Sorry.
want to. We have a lot of great information at
Yep.
WCN dot. So go maybe and then. And then sorry.
Okay. Oh, no, that's okay. I'm just trying to think about where
So
we
much
go from
information.
here.
Great
Yeah.
information. Yeah.
Well, and someone said that they, nursing has a ton of choices as careers. So I hope that I impressed you that you did. Nurses, again, also have a lot of influence. So I don't know if you see this. This is a picture of Patty Hayes. So she's a registered nurse. She's actually in charge of public health, Seattle and King County, and in charge of all of our COVID-19 efforts here in the state of Washington. They also become elected officials. This nurse here, Cheryl Flug, was a senator in the state of Washington before she was senator in the state of Washington, but she was a nurse before that. And here's me because we all lobbied to pass health reform in the state. So here's one of my favorite pictures when I went to the American Nurses Association convention in Washington, D.C. one year. President Obama came and talked to us personally because we helped him get federal reform passed at the federal level. And also nurses work in really interesting areas like environmental health. This is my friend Karen. She's an environmental health nurse, and she worked to pass a law so that there weren't toxins in water bottles. Now, people weren't aware of this, but there was a toxin called BPA that was in plastic water bottles for years. And we found out that as people drank their water, these chemicals would leak into them and literally cause effects in your bodies that you couldn't have children. And it was really serious. And so she went up to Capitol Hill and lobbied for that and now it's banned in the state of Washington. So I just wanted to share with you really a lot of the opportunities in nursing. Most registered nurses, I love this statement, we surveyed them, they feel like they have a sense of accomplishment, right, when they do their work. So it's a very positive thing to choose as a career. And as Brenda said, if you have any other questions, we have lots of resources at the Center for Nursing. I'm personally happy to answer any specific questions you have because we have a short amount of time. Just send me an email or give me a call. So I appreciate my time with you today and hope you choose nursing because we really need you.